but you're with us for now. You're also with Dr. Ryan Smart from Syracuse Orthopedic Specialist. Time for our weekly SOS House Call. Dr. Smart, thanks for joining. How you doing?
I'm good. Thanks for having me.
All right, let's start in the NFL. And I think we were all watching the games over the weekend. We saw Eagles quarterback Jalen Hurts injure himself, his leg, his knee, whatever it may have been towards the end of that game. He did finish out the game. Could you tell from just visually looking at it what the injury is and maybe how that might hamper him, moving forward here into championship weekend?
Yeah, I think the fact that he finished the game is a really good sign that nothing probably seriously structural happened. I mean, with that type of injury, you can just strain the tissue, the quad, the muscles, kind of the knee just gets, flexed in such a way it's not necessarily meant to go. So it can just be sore and hurt. But I would think something like that, he should be pretty good to go by next weekend.
Eagles fans certainly hope. That's Jalen Hurts' knee. We got another Eagle with a hurt shoulder, as those are your specialties, Dr. Smart, surgical repair of the shoulder and knee. They got Quinyon Mitchell, one of their cornerbacks. He also had to leave that game. He did not return, and he was reaching for his collarbone on the sideline. So I was kind of looking on Twitter, and one doctor who specializes in fantasy sports updates and just assessing injuries speculated it was a minor AC sprain, and that's why they think he's going to come back, but they were playing it safe there. If that is the case, how likely is it he will be able to play, and what kind of treatment is a guy getting with an AC sprain if they're going to play in a football game?
Yeah, that's definitely a playable injury. It becomes a bit of a pain thing. A lot of times that's one that you may inject with cortisone shot, even now to try to get it in, decrease pain. And that, especially if it's a minor sprain, there's really no particular risk to further injury. So that may be kind of old school where even before the game you get a shot to kind of numb it, just so because it just hurts, but it doesn't really decrease function. So if that's the case, usually within a week, if it's a low sprain, you should be feeling a lot better anyways. But if not, that may be one that you'd consider injecting.
All right, let's go to the NBA, and we've seen the New Orleans Pelicans this year have been one of the most disappointing teams of the season, in large part, I think, due to injuries, and they just received some more bad news a little over a week ago that Herb Jones, one of the league's top defenders, suffered a labrum tear in his right shoulder. He's out indefinitely. What would the timeline be for something like that? Why are they saying indefinite, and what would team doctors be looking at when determining whether or not he'll need to go, undergo surgery on that shoulder?
Yeah, I mean, you'd get imaging, so you'd want to get an MRI of the shoulder, and you can kind of see the extent of the damage because, those kind of injuries, some look worse, some are better. And then from there, usually what you'll do is just take it day by day, because you can play with a labral tear. It may hurt, and then it can cause sometimes a little bit of instability in the shoulder. But I think the indefinite is they just don't know. Like, hey, if the labrum's torn, let's take it day by day, see how you feel, how's your motion, how's your strength, and then go out and practice and play and see how it feels. And then, hey, if you feel good, let's keep going. You're back, you can play. But if it's not, or they're struggling with it, that's when it may get kicked over into a longer timeout, or potentially, hey, do we just fix this and get it over with surgery?
Such a talented team. It's a shame with Zion, Brandon Ingram, CJ McCollum. Another team, kind of the same issue, but more with one player, the Sixers. Stop me if you've heard this before. Unfortunately, Joel Embiid's injured again. He was dealing with an issue with his left foot. Now he's got left knee swelling. You're not his doctor. You haven't checked him out, but I'd like your perspective on this. He's missing 35 games a year since he got drafted in 2014. A lot of them have to do with his knees. What's the process like of telling a guy that maybe he shouldn't play anymore? Like, I know guys will go see multiple doctors and get second opinions, and I know you don't want to tell an athlete that, but in your opinion, what would you have to see to recommend to an athlete, hey man, I don't think you should be doing this at this level anymore. It's just too much of a risk.
Yeah, I mean, I think it depends on a lot of the imaging. I think with him, he must have like early arthritis in the knee, which again, I think we've talked about before, which is wearing the cartilage. And then that just causes, it never goes away. You rest, you feel better, and then it just constantly keeps flaring up and swelling up. And I think that's why he's always got to miss so many games, because he's just trying to manage the body. But you know what? That's a personal decision. I mean, a million years ago, my sport was hockey, and I got hurt and got shut down. And I tell people, I try to be truthful with them and say, listen, this is your problem. This is what's going on. But truth be told, it's really individual, and it's going to come down to him and the realization that he kind of can't do it anymore. And he's just maybe not as good as he wants to be, or it really is not enjoyable to constantly play with the body part hurting. So, you try to be frank with the athlete and tell him, but in that situation, I just try to be truthful and tell him, but at the end of the day, it's going to come to his realization that he just can't do it.
Just like brief follow-up, because you mentioned, the arthritis. Does it increase injury of something very serious, or is it kind of just flare up, get better, and it's how long does he want to deal with it? Or does it increase the risk of like him having trouble being able to walk or suffering a big injury?
Well, it can. I mean, you do. Arthritis in general, I tell most people, you're not necessarily injuring it by trying, but arthritis is degenerative and considered progressive. So we know it's not going away. The trend is for it getting worse. So if you continue to pound on it, you may accelerate needing, a surgery, or in your lifespan, like say a knee replacement. And certainly then you get into, if you are favoring that body part, you put other joints at risk, aka like the other knee. And we'll see that a lot with younger kids, especially the female athletes. If you hurt one knee or tear an ACL, they're actually pretty higher risk to injure the other knee if they don't rehab properly and whatnot, and it leaves them a little bit vulnerable.
All right, Dr. Ryan Smart joining us here, weekly SOS house call for another minute or two. For the rest of us, Dr. Ryan, as we head into the winter, are there certain injuries that you tend to see more of this time of year? I would assume skiing injuries are, high on your list. What are at the top of the list in terms of the injuries that you see, and how can we go about preventing them?
Yeah, certainly the skiing, the snowboarding, and that's either falling, which you can hurt any part of your body, but certainly knee injuries in the twist. And that's just, sometimes it's fluke, right? You can't even avoid it. But then other times it's maybe not being as good a shape as we should be. And we go out and do activities that can injure us. And so that's probably the most recreational injuries we'll see at this time of year. And then the other one is with the ice. I see tons of people just slip and falls on ice, jamming elbows, hurting shoulders, hurting ankles. And, that's a sense of being careful, but it's also, again, and I found as I'm getting older, you get a little stiffer and the muscles aren't quite as strong as they should be. So if you do slip, you're more vulnerable. So I think in general, it's basic, man. Just stay in shape, stay flexible. And be wise. I mean, particularly with skiing, I see more people get hurt by getting run into by somebody else. And I hate to say it, but you almost got to ski nowadays with your head on a swivel just to know what's around you and what's coming down the mountain, because that's a lot of the ski injuries I'll see.
All right, Doctor. As always, we appreciate the time. Thanks so much for coming on. Enjoy the rest of your week, and we look forward to doing the weekly SOS house call again next week.
All right, guys. Thanks a lot for having me. Take care.
All right, you as well. Dr. Ryan Smart joining us here on the program. And with that, we'll open up the phone lines for a segment, 315-437-7644. It's funny how this happens, Jordan. Syracuse loses a game, and we take phone call after phone call after phone call. Here we are 45 minutes into the show, and yet to receive a phone call after a win.
That's not true. We talked to Paulie.
Well, I guess so. But
Paulie
he doesn't
was here
count.
yesterday. He was like, I gotta do a segment with you guys. So
he doesn't count.
Paulie's here
for a
us.
lot of reasons.
That is rude.
I know. Phone lines open, though, here up until 1 o'clock. Mike McAllister, 1 o'clock. Jim Coventry, 1:30. We're back after this on ESPN Radio.
Tomorrow.